Hi everyone, this is Dr. Blake Bloxom, the Chief Medical Officer of HairDAO and Anagen, and today we are here to talk about 1 milligram oral finasteride. This is the classic solution to keep what's yours and maybe grow even more. Okay, so how do we use 1 milligram of oral finasteride? So you take a 1 milligram tablet once daily with fluid, ideally at the same time each day for consistency. And remember, finasteride can be taken with or without food. Now it's important to stay consistent. Most men begin to see visible results after about 3 to 6 months of use, and its continued use is needed to maintain these benefits. Okay, so why 1 milligram finasteride? So finasteride is a selective 5-alpha reductase inhibitor that reduces scalp and serum levels of DHT or dihydrotestosterone, the hormone most strongly associated with male pattern hair loss. Now, unlike topical therapies, oral finasteride works systemically to halt miniaturization of hair follicles and support long-term regrowth. In 1999, McClellan and Markham conducted phase 3 clinical trials involving 1,879 men taking 1 milligram finasteride daily for 2 years. Now, these patients saw a 48% improvement in hair growth at 1 year versus 7% in the placebo group, a 66% improvement at 2 years compared to 7% in the placebo group, and 83% of men had no further hair loss after 2 years compared to 28% of the placebo users. So in 2023, Yanasago et al. Published a study of a 10-year observational period in 532 Japanese men. Now, in this study, 91.5% showed visible improvement in hair density, and 99.1% maintained or improved their baseline Norwood-Hamilton classification. And this study also showed that long-term users had a mean photographic score improvement of +1 grade, with significantly better outcomes in early stage hair loss groups. And so together, these studies confirm that finasteride is a highly effective treatment both in the short and long term, especially for men in the early to moderate stages of hair loss. Okay, so let's talk about a little bit of a controversial issue, and that is the safety and side effect profile of finasteride. So in this video, we are going to stick with what is published data from studies. So in general, what we can ascertain from these studies is that finasteride is generally well tolerated, even in and through phase 3 clinical trials. And so when we take all this evidence together, what we see is that 7.7% of finasteride users reported treatment-related side effects versus 7% in the placebo group. Now, the most common side effects that are seen are related to sexual function, and this includes decreased libido, ejaculation disorders, and erectile dysfunction. And these issues resolved in most men who did continue the treatment and fully resolved in all men, according to these studies, who discontinued therapy. It's also important to note that no other side effects, aside from the ones we just discussed, occurred at a rate greater than 1%. Now, a very important note here, this medication, 1 milligram finasteride oral tablet, is for men only. Women who are or may become pregnant should avoid handling crushed or broken finasteride tablets, as exposure may pose serious risks to male fetal development. All right, so a quick note on FDA approval. So finasteride 1 milligram is FDA approved for the treatment of male pattern hair loss or androgenic alopecia. It's one of only 2 FDA approved medications for this indication and is widely considered the gold standard oral therapy. All right, so if you're using 1 milligram oral finasteride, join our community. We'd love to follow your journey. Share your before and after photos, share your experience, ask your questions, tag us on Instagram, on X/Twitter, on TikTok, or join our Discord community to post updates and connect with others who are going through the exact same journey. And in doing so, guys, let's do it. Let's get hairy together.